Hi, you're watching The Savera. This is Amarpal Singh before you. Liver disease is a growing concern. So, to understand the factors, the impact, as well as about the liver transplantation, we are having with us Dr. Nirmaljit Singh Malhi. He is chairman as well as HOD of Advanced Gastroenterology Institute, Ludhiana. So, welcome, sir, to The Savera. So,
Thank you, Amarpal.
what kind of diseases you are commonly finding in the patients nowadays?
So, Amarpal, okay. So, the common conditions we now see in Punjab and the surrounding areas, one is because of the alcohol, which has always been there, and alcohol-related liver disease. Other was hepatitis B and C, which now with the intervention of the medicines and government initiatives has gone down quite a lot. But the biggest emerging cause of liver disease now in Punjab is what we call as non-alcoholic, or now it is called a metabolic syndrome associated fatty liver disease. So this is where people who are either obese or overweight or who are diabetics with very poor physical activity, this is one subgroup which has a very high chance of fatty liver and progression to an advanced liver disease.
Okay. So, what kind of signs, early signs, one can recognize about liver dysfunctioning?
In very early stages, there are hardly any signs. It could be very vague symptoms. People feeling more fatigue, which is there, some non specific discomfort in the abdomen. But if you do testing in those people, you will start finding blood tests to be getting abnormal, mainly the liver function test or LFTs, and ultrasound abdomen showing presence of fatty liver.
Suppose I am a person, how can I identify that I am suffering from a liver disinfection?
That will depend upon if someone who's overweight for a long time or obese, or someone has been diagnosed with a recent diabetes or diabetes is there for 5 to 10 years, or someone who's regularly drinking alcohol and where the physical mobility is very less. So this is a subgroup of people who should get a very routine blood testing and periodic basis ultrasonography of the abdomen.
Can liver disease be reserved or reversed, or is there are other options?
Yes, that's a wonderful question. Liver has a good potential for regeneration and hence has a component of reversibility. But in that, the most important thing is you have to pick these people at a stage when the irreversible component is very little. That means disease should not be far advanced. Patient should be able to take doctor's advice at the right point of time, good medications and lifestyle changes. So liver reversibility always is there.
When is a liver transplant the only option left?
That is when there is an irreversible liver damage, which we call it as a cirrhosis. And in the cirrhosis, there are so many complications. Recurrent bleeding, there is formation of fluid in the abdomen, which is called ascites, or patient is becoming repeatedly altered or encephalopathy. And with these, the role of medical therapy remains very little, and transplant is the obvious choice to prolong and sustain life at that point of time.
Today, you have spread awareness about liver transplantation. Even you have felicitated some donors as well as patients.
Right.
What kind of there are some misconceptions also in the public regarding liver transplantation, as well as there are misconception in the donors. So, what kind of misconception you usually find in the patient as well as the donors?
The number of misconceptions. One is that possibly liver transplant does not have a high success rate. People believe that liver transplant means it's sort of a death knell for a given patient. That is absolutely untrue. Transplant is an excellent modality, and this is the only modality that people with advanced liver disease can live their normal life. They can have a longevity anywhere between 5 years to even 25 years or beyond. Two, people think that if a donor, someone gives a part of liver to a recipient, his life is going to be incapacitated. That is absolutely untrue. The donor liver regenerates to normal size within 3 months' time, and donor absolutely lives a normal and a healthy life.
What lifestyle changes you recommend for the patients?
One is alcohol. Alcohol, there should be no alcohol, which is very, very important. Two, optimization of the body weight. Someone who's obese or overweight, taking control of body's own weight is very important. Third is people who are diabetic, very good control of their diabetic status becomes again very, very important. Fourth is vaccination for hepatitis B virus. Hepatitis B is completely preventable. Someone who's not vaccinated should get vaccinated. Fifth is an proactive and a healthy lifestyle. That means diet, which should be in moderation, exercise, which should be on a regular basis, and weight, which should be near close to the normal body weight for that height of that individual.
Thank you so much.
Right.
So he is Dr. Nirmaljit Singh Malhi, HOD at Advanced Gastroenterology Institute, Ludhiana. So he has given a valuable insight about liver diseases as well as liver transplantation. So you stay tuned to The Savera for more updates. Follow us both on Facebook and YouTube, and also download our mobile application. Amarpal Singh with cameraman Manoj Sidhu.